of the big problems face Chinese medicine nowadays is the safety. People say, well, you have so many medicine, herbs and everything you give to people, many doctors, many Western scientists always criticize the safety because you never had any tests or the safety tests. I said, yes, I agree with that statement. We concern the safety. Does not mean we're not safe. So I answered them. I said, yes, the Chinese herbs compared with Western medicine drugs, we didn't go through all these sort of 3 stages clinical tests and also toxicity tests, other tests. I said, why we didn't do that? There are 2 reasons. Obviously, we don't have such money. To do this is so expensive. If every herbs we do that, we have 10,000 herbs, we'll bankrupt whole China. We can't do that. We don't need to do that. Why? Our medicine are naturally there, the herbs, the plants. We don't in fact make any new compounds. And the most important thing, those herbal medicine, we use them, and in fact, we do have many thousand years collective experience and knowledge. Even in our encyclopedia of Chinese medicine, we already told certain herbs are poison, certain herbs are not poison, or certain herbs are very safe. So that's why we divide our herbs into major 3 categories called up, middle, low. Let's say low back category are poisonous, so only for very serious conditions such as cancer or snake bite. Some medium category is for some illness such as say stomach pain or constipation. The up level of the herbs maybe it's good for tonic. Such people say, I feel weak, I feel tired, low sexual libido, or I can't sleep well. So those are tonic. In fact, we already use them a lot in our food. Let's give you an example. Ginger. Ginger is one of the very common use in the herbs. In our medicine, we call them warm the stomach, clear the sickness, expel the cold. Therefore, it's already used. Why would we test ginger for safety? Anybody want to test ginger safety? I think it's a waste of time. With a Chinese medicine, although we're not tested, like in the way of Western medicine tested, but we do have a testing. We have so many thousand years testing and so many billions of people testing. So which do you believe then? You believe 1,000 years, billions of people test, or only have a couple of thousand people test in the lab? So that's why I said, well, for example, even in the West, you talk about safety. Do you ever testing apple safety? So that's the same goes with Chinese medicine. So in the way, I said most of the Chinese herbs, we don't need a test.